On the latest in the fight against the coronavirus, reinforcements are on the way to help Michigan, now the hot spot in the nation. The Department of Defense is now sending 44 more healthcare workers to 2 hospitals as COVID-19 cases continue to rise through our state. Michigan has one of the highest case rates in the country. The state reporting more than 17,000 new infections over the last 2 days, an average of 8,500 a day. The health department also recorded 280 more deaths from the virus. One of the hospitals receiving extra help is Beaumont Dearborn. 7 Action News reporter Peter Maxwell is joining us live now from Dearborn. And Peter, what's the surge looking like there, and what kind of help is Beaumont Dearborn receiving?
Well, good morning. Beaumont Dearborn is up 100 patients since last week, and the help. It's a serious situation to be in, one that health officials in September predicted that could happen, and now it is. 9 hospitals across the state at full capacity.
These hospitals are at capacity. They're experiencing caseloads that are significant, not just of COVID cases, but other cases as well.
Extra help now on the way to the front lines.
Our teams are so burned out and struggling to keep up with the amount of patients coming through the emergency rooms. And what's different now is just the level of their sickness is so much greater in severity.
David Claes is the president of Beaumont Dearborn, one of 2 hospitals in the state and the only one in Metro Detroit to get this much needed help. Reinforcements will allow Beaumont Dearborn to take care of more patients, not only in the emergency room, but throughout the hospital. The hospital is set to receive 22 nurses, respiratory therapists, and physicians early next week after having a 200% increase in COVID patients since September.
Our infectious disease doctors feel that the COVID patients will exceed the surge from last year.
But this help is far from enough, falling well short of the 150 workers initially requested by the state's hospital association.
There are and have been very serious circumstances in Michigan at different times over the past 20 months. And I would say that this is one of those times.
The state says there's a long list of hospitals requesting help, but right now there's not much else they can do.